It's Shift Talk Time! So welcome to SingHealth's nursing podcast, and in this episode we have Ms Julia, who's an advanced practice nurse and the Director of Nursing at the National Cancer Centre Singapore. So with that said, I think we'll just try to break the ice a bit for us to get to know you a bit more beyond your nursing career. So for this, I will hand over time to Yen Lin.
So we're going to do something like rapid fire. The question will be this or that lah. So we have a few questions. Okay, gonna start with first one. Summer or winter?
Summer.
Okay.
Summer? Okay.
Then Singapore is a perfect place for you then.
Yeah. Okay. Bedside care or desk bound?
Bedside care.
Perfect. Okay.
Okay. Morning, afternoon or night shift?
Night shift.
Why? Why night?
I think I'm more of the night person.
Okay.
And I enjoy the night environment, going around. You know, it's like the nightingale with the lamp.
Going around.
So I like to go around with my torch last
The
time.
night shift is longer, right?
Night shift is longer, it's 10 hours. Yeah, but I like night shift.
Nice.
Wow. Okay.
Yes.
Sunrise or sunset?
Sunrise.
Sunrise. Okay, then night shift is great for you then. And
Yes.
Yeah, then you can see the sun. Yeah.
Correct.
Introverted or extroverted?
Introvert.
Okay.
Okay, interesting.
Yes.
Okay. If not nursing, then what would you pursue?
Policewoman.
Oh,
Oh.
okay. But introverted. So I'm thinking how
that clicks, right?
Yeah, how that clicks. Maybe.
I think it's the I don't like desk bound, right? So police is maybe more of the I like the uniform.
Yeah.
I like the uniform, and I like the how should I say, the ability to be able to. There's some independence in being individual.
Yeah.
In terms of the police work, investigative work. That sounds very interesting, right? Exciting. Yeah, so I like that kind of assignment in a way.
Okay.
Before I joined nursing, I also thought I want to be a policewoman. And then I joined NPCC in secondary school because of the uniform. But then after that, I visited police station, go and through the shooting, everything. I decided not to. I realized they need to run after the thief. Okay, I hate running.
That's true. Yeah, that's true.
But okay, that's cool.
Yeah.
Okay, what's your go-to comfort food?
Go-to comfort food McDonald's.
Oh, McSpicy.
Yes.
Okay. What's your biggest pet peeve?
I think I'm quite a chill person. I think
okay.
it's quite difficult to
Annoy you.
irritate me. If you can irritate me, I think you're quite good.
Okay. Now we know.
I think my tolerance level is very high.
Quite high.
So I can tolerate.
Nonsense.
Yeah, I can tolerate a lot of things. Like my house, right? My kids, they're quite messy. They're big already, but they're still quite messy. So my husband cannot take it. So he will grumble, right? They say they're adult already. Why do you want to bother, right?
Yeah.
But he cannot take it. But I can. Even how messy their room is or how messy their toilet is. They can mess it up lah. They can be very dirty. I don't care. I can be so chill
So
to that
chill
extent.
mom,
but my area, I have to
Keep it
self-keep
tidy,
lah.
of course. Of course.
Okay.
Yeah.
Okay.
That's quite good.
So that pretty much sums up our rapid fire segment, just to kind of get to know you on a personal level. So with that, we'll kind of get straight into the questions, just to better understand your role within nursing and how you can be an inspiration for many of them watching this episode. So maybe Yen Lin, you want to kickstart with the first question?
Yeah. Actually, this is for like everyone. When I first heard of APN, I don't actually know what's your like job scope and what they'll do, and what's the difference between APN and doctors.
Okay.
Yeah.
I think it's very, people have that kind of misconception. I think it's a grey area because we do a lot of what the doctors does, right? And the APN role nationally, I think we are a hybrid of like specialty care nurse and nurse practitioner kind of a role. So more like a clinical nurse specialist in the US context. It's a clinical nurse specialist and nurse practitioner.
Yeah.
We are the hybrid of both. So some of the work that you see us, what we do is we still do the counseling as like how our specialty care nurse does. The add-on things that we probably does in, a lot of us is the investigation, assessing patient, be able to diagnose, and be able to diagnose and all that is more, and carry out investigation, review results. These are more like the doctor's role.
Yes.
So that's why people get confused in terms of like, are we doing the doctor's part of the work, or are we doing the nursing part of work? But I would say it's a hybrid of both. And I think that gave an advantage to the patient, because then patient doesn't need to hop and see so many people. So I think in the healthcare system, I think what patients sometimes go through is they need to see one person after another. So if there is somebody like an advanced practice nurse who will be able to consolidate some of the information and when needed, discuss it with the team consultants and then develop a plan.
Can you prescribe medicine?
Yes, we can. So since 2018, 2019, MOH actually developed a program that is for us to do prescribing. So with that, we are able to prescribe a list of approved medications. So that actually helped a lot in terms of our work, whether is it in the clinic or is it in the inpatient setting. That helped to expedite a lot of care for the patients.
And patient no need to wait for so long to see
and I think it also helped nurses in a way, because if it's in a ward setting, right, a lot of time y'all wait for a houseman to order. Or if the ward got no houseman, like surgical wards don't have houseman, you get
call and call
and cows come in. Get people to come in.
Correct.
So that with the APNs in the ward, it actually helped a lot in terms of expediting processes. Even ordering and reviewing patients in the ward, right, with the ward APNs, you're then able to expedite a lot of reviews. And it also makes your the nursing tasks a little bit easier.
So there's this overlap which kind of leads to that misconception that nurses are essentially doing what the doctors are doing, or at times maybe lesser than what the doctors are doing. So I guess from what we understand, it's that the job scope kind of helps to alleviate the workload for many of the bedside nurses, I suppose. Because you guys are kind of like the substitutes to go and kind of review the patients and give some sort of like a care plan for them to not have to stay too long waiting for the doctors to come into the picture.
I wouldn't say it's like a substitute, but it would be more of a role redesign kind of a framework or a model that as we progress, right, I think we need to take a higher level kind of work, whether it's as a patient, for patient care or to elevate the profession, nursing profession. So with that, right, in terms of advancing our practice, I think a lot of nursing team, right, or nurses, they are actually able to perform. It's just that they may not have the opportunity to do. Some of the ground nurses on the floor, they actually are capable. So they're able to tell you when they can't report to the APNs, right? Like in my own experience, some of the nurses on the ground, they will be able to report to the APNs to say that, hey, actually this patient is not well, the vital sign is whatever, and I need you to go and do a review. So in actual fact, they know that the patient is not well, they need expedited care, and they're able to report to you. So in a way, it's also advancing their practice. So with that, I guess is growing as a whole entire profession.
I think I like what you said when it comes to sort of not just making it an exclusive job scope for an APN, but you guys are also empowering bedside nurses to not only make decisions, but know when to kind of step up or kind of flag up something that doesn't seem right. And I think it also helps that, let's say, you're the APN in the ward and I'm the bedside nurse, I feel more comfortable perhaps going to you and saying, no, hey, I think something is wrong, and I think could you come and review, and then maybe that can decide whether you should bring it up to the doctors or whatnot.
Yeah, because I think some of the junior nurses, they may have concern, or they may be worried going to the MOs or even the registrars to report certain things, right? So going to the APN is probably easier for the junior ones, But for the very senior one, usually, like last time when I was a senior NCs, right, working in a ward, I will just go straight to consultant because I am very familiar with them. Working in terms of the working relationship, the trusting relationships. But it may not work the same for the juniors. So the juniors, it's easier for them to go to the APNs.
Okay.
So what we are hearing from you now, I think the profession has already advanced quite a bit. Like you've talked about prescribing. I think there's more autonomy for APNs nowadays as well, like in decision making, in the care plans and all that. But I'm sure like it would have started somewhere at a very nascent like stage. So how has it evolved over the years, like this whole role of an APN? Like where did we start? Or how did the beginning the early days look like?
So the beginning APN, what did it do, and what's the difference now?
I think we started quite it's a very challenging, it's really ground zero, right? We started from ground zero, and when we do this, we started off with specialty nursing, because the specialty nurses are those who already have that skills and ability through their experience, through their skills developments and all that. So for them to take up that extra knowledge or learn the extra knowledge and going through the program is actually easier. But of course, then it comes with the challenging of the licensure, the governance, and then of course the trust from our physicians, our doctors, right? As part of the care team. But I think we have evolved and has been able to build the relationship, the trust from the team, whether is it our consultants, the junior doctors, to our nursing team, as well as allied health, because we also work very closely with the allied health team. So that has, in a way, made, the profession has kind of like matured. It's 20 years, 20 over years slightly. So also in our own individual way is we have a bit of, not a bit, but I think we self-governance a lot. We make sure that our practice, we keep our competence. We continue to practice in our clinical, like now that I'm a DN, I'm still going back to my clinical in KK. I practice back in KK instead of NCC. So I still have that practice to make sure that I'm keeping myself up to date. I stay relevant. So I think we have quite a bit of this self-governance as well. Building that credibility. So as we mature, we build that credibility among our profession. And of course, ministry has helped a lot. Make changes to training curriculum, develop curriculum for prescribing. That shows in terms of the trust that they have on the APNs.
I think that credibility is the most important part here, right? Because I think the moment you hear there's a nurse coming to make certain decisions that are very similar to what a doctor does, I think you expect a certain level of competence, right? Like on what grounds are you making that decision? So your licensure helps, your experience in this field helps, and building that credibility, not just for yourself, but for the profession over the years would have made a lot of difference, I suppose. Right? Compared to, I guess, the early days when maybe there's still some skepticism among like the patients and even, like you said, the medical team to kind of have you on board for the decision making.
So I think patient trust is very important. So at the very early days, we do have patients that ask, why am I seeing a nurse? I ever had just one patient who it's the caregiver lah who actually come in and say, why am I seeing a nurse and not a doctor? So I have to explain my role and things like that.
Even now, like sometimes when we at work, on our field, so if we need to explain anything to patients, then they see a nurse, then they're like, then they'll be like, oh, don't really trust us. Once the doctor come out, they're like, oh, okay. It's still like that.
So it's building that trust with the patients. So now that we are quite established in running our clinics, right? Some patients I tell them, say, no, next visit you need to go and see a doctor. I said, do I have to see a doctor? I say, yes, you need to see a doctor. After that, you can come back and see me again. I say, you need to see at least the doctors once before you come back and see me again. So then they'll be quite happy. So they're quite happy to stay with me in my clinics.
Okay,
Good.
wow.
So I'm sure like the role, like from what you've explained, it has made an impact in how we see nurses and nursing as a whole. Right. So how successful do you think we are in terms of the APN role, making the image of nursing, kind of elevating the image of nursing? Do you think there's more we can do, or have we kind of reached the ceiling in terms of how successful we can, how good are we at elevating the image of nursing?
We definitely will be able to elevate the image of nursing or the advanced practice to the next level. Now we practice as we have this collaborative agreement prescribing agreement guide with us, right? So I think as we get more mature in our practice and our trust with patients and healthcare professionals, I'm hoping one day we can do without the collaborative prescribing agreement.
Right.
That gives us a little bit more autonomy in terms of the practice, and that not only just elevate our own APN practice, right, but is elevating the rest of the nursing profession. Because then slowly I think the rest of the nurses will then be able to take on higher roles and responsibilities in managing the patients, in making decisions of how the care is like in the ward. Because now we have got different grades of healthcare providers. We have got CSAs, we have got enrolled nurse, and our enrolled nurse are now also taking up higher skills, right? Because they are highly they are trained better in the IT, higher NITE. So then it's elevate every level. And of course then is the whole entire health ecosystem of the healthcare practice.
So the more sort of competencies you are kind of giving these respective groups of nurses, the more that their practice kind of improves as well. Because I think the APNs is a good example. That's how, compared to how nurses are seen as just bedside providers. In your case, as an APN, I'm sure you'd have seen being a decision maker. I mean, nurses are decision makers as well, but as an APN, I believe you have a greater sense of leadership in that team, and you're able to kind of navigate that care plan with, of course, with your licensure and your experience doing it. So I guess, which makes sense. I mean, I think that's the thing we want to kind of understand, how exactly is the APN elevating the image of nursing and what more we can do. I think we kind of answered it very well, which kind of leads very well to the next question. If there's something you want to change about the job scope of APN right now at this point, what will it be? I think you mentioned about kind of doing away with the collaborative prescribing, but is there anything else you think, if let's say right now you're given a chance to change, one thing you can change right now, what will it be and why?
I hope we can have open prescribing instead of the limited prescribing, because we are seeing more patients who have got other chronic disease, and if we could manage them in a holistic manner, that will actually be quite perfect in a way. But that would also mean that we have to elevate our competencies, in terms of managing patients on a broader scales, because we are generally broad trained, broad trained, right? So, and a generalist. So
Yeah.
if we could have, elevate our competencies and then eventually be able to have open prescribing rights, then it will give us a little bit more independence.
Yeah.
Yeah.
Which kind of goes back to the point on trust and
Yes.
credibility
Yeah.
as well. Like, for example, if you're given that prescribing rights, then you're expected to have that trust from the patients that what you're giving is actually going to work.
Yes.
You know what I mean? So I think it kind of links well with what you've said in terms of trust, credibility, competence, and the rapport that you build with the patients for them to know that, you have their best interests at heart. So yeah, makes sense. Yeah.
Actually, I'm very curious about like how long do you take to reach where you are today? Like after how many years of working, then you decide to study to be an APN, and how long is the course? And
Actually, I started quite early in my years of nursing. So the moment I stepped into oncology, right, I was maybe in my 4th year in nursing. Then at that point in time, I already know that I wouldn't want to go into direct management. I like my bedside care. I like my patients. And that's the time when I start to think that, okay, I need to beef up my knowledge to be able to give patient the correct advice, be able to give the correct, make the correct decision, and make the assessment and be able to communicate that on the same level to the doctors. So that makes me feel that actually I'm very incompetent. And I asked to go and further studies.
Yeah.
So when I start looking at the study program, right, it's the clinical study that I wanted to do. So I eventually went to Australia to do that, because that time Singapore don't have the program yet.
Okay.
And just, I think after I left to study in Melbourne for 1 year, the NUS program started. Yeah, NUS program started. So when I came back, I couldn't practice yet because the regulations and all that wasn't up. Yeah, so I have to continue to do my specialty care role in my oncology patient. And that helps to build my confidence and the trust with my doctors. So then that blends in very well when I finally got my APN license. And the doctors already know me quite well and my capability. So it's easy for me to then develop that clinical role as an APN.
Yeah.
So I actually got a lot of decision autonomy making in managing my patients from my surgeons. Correct. So so short answer is I know very early my nursing just what I want. And I move towards that.
Right.
Wow.
Nice.
And I think is star aligns that after that all the things just fall in place.
After your course, then
Correct.
NUS started.
So I must say that I'm quite lucky.
Does NCC or any of our institutions send people to study in NUS for the course and an APN?
APN, within SingHealth, we always send
APN straight.
APN straight, So for those who wants to go to the APN track, they all goes to NUS for the program. But we do have a few that are overseas trained. That is funded by the institution. So we do have. So on a yearly basis, SingHealth we send good 10, 11.
Okay, so it's,
on average, I think we got
So
about
anybody
15.
interested?
Yes,
10 slots.
so are you all interested?
it's a separate conversation we will have after we cut the thing. Yeah. But I mean, so the talent pool is constantly growing.
Yes.
Right? So I think also going back to what we've been discussing, I think the biggest takeaway would be the fact that at the end of the day, if you want the image of nursing to grow, your competencies and capabilities must also grow.
Yes.
And I think the APN role is a very good example, right? I mean, of course, bedside nurses also empowered with more competencies, greater capabilities and all that. But I think a living example of like a complete role redesign, like you mentioned earlier, is the role of an APN, whereby you are able to, so it's not necessarily you're doing what a doctor is doing. I think the perception should be more of within the scope of nursing, we're able to do more.
Yes.
Rather than seeing as, oh, someone else is doing the same thing.
Yeah.
So are you a doctor's assistant?
Yeah.
I think that is the misconception that many of us have.
Yeah.
Oh, because you're doing what they're doing, so you're essentially an assistant. But actually, within the scope of nursing, what you guys are doing is far beyond what we have imagined
it's actually
long ago.
really
right?
demonstrating that actually nurses can do more than what
Yeah, correct.
people see us doing.
Yeah.
And all of us have that potential.
Yeah.
Yeah. It's how willing or how people wants to come forward to advance in their role.
Right.
Yeah. So sometimes sometimes in my own thinking, right, is whether you call it advanced practice nurse or advanced nursing practice. Because advanced nursing practice is also something what a lot of our ground nurses are developing into, so that is advancing your nursing practice.
True.
Actually, I want to ask, like, how have you grown as a leader?
That probably have to start from I was tasked to lead the APN in KK.
Okay.
We started off with 3 APNs. And at that point in time, we envisioned that we should have at least 2 APNs in the ward. So we are very much ward-based kind of an APN right from the start. So with that, together with my other 2 partners in crime, we we kind of like work together to develop how we want our APNs to be like, and we start to identify the nurses who are actually interested to go on this clinical track. So we started off first with the oncology, because that's my area of specialty, and then it then makes it easier to build and identify people. Then we went on to develop the pediatric and the general gynae APNs. So we worked out like how the training program within KK is going to be like. How we, with a few of the senior people, we started off with like the resident nurse in KK, and then from there we built on and developed their competencies and things like that. So that in that sense, that leadership component, whether I like it or not, it has to come, right? It has to come, because I have to think that I've got this team of nurses who I first need to build. 2, I need to, build them in such a way that I have the trust of the physicians in order to build more. And be able to contribute to giving a good patient outcome in that sense. Whether or not the patients stay shorter, because we used to stay quite long in terms of the surgical patients, but we managed to cut down the patients' length of stay with the APN's involvement. So then I had an opportunity to be seconded to MOH for also to work on APN development work. And with that work, it really built my leadership capability in seeing things at a different level. At the ministry level, that gives me the opportunity to learn how the landscape of APN landscape is, and building that into the national healthcare landscape. Then able to see in a broader scope. And of course, with CNO, then able to give us the direct mentorship in terms of how we should be leading in that way. So that is probably quite a game changer in terms of how I see things in a broader scope. And then when I was in the midst of doing this work with ministry, of course, then is also at the same time looking at how to develop APNs within SingHealth. So then I was tasked by GCN to work on the APN development work group to see how we can strategically place and build APNs in SingHealth. So with the few of the pioneers in pioneer APN within SGH, CGH, SK, we kind of like came together to work on what are some of the key things that we want to look at, and that's when we developed the master program
To prepare the nurses.
to prepare the nurses and how to identify. Also at the same time coming up with like a roadmap that we could actually tell our nurses that okay, these are the roadmap if you want to develop to go on to the clinical tracks towards APN. Yeah, so that builds on in terms of the leadership skills. And of course with that I have to then talk to even more people, right? So as you talk to more people, you learn new things. You learn new perspective. And that's how I kind of like build my own leadership and how it kind of like evolves.
And
So-
now
So you started with 3 APNs, and now how many APNs do we have in KK?
In KK, I have about 40 odd of them now.
40.
Yeah.
Wow, that's over how many years?
Since 2010.
Wow, 16 years.
Yeah.
Okay,
Wow.
then how about the whole SingHealth cluster? How many
Whole
do we have?
SingHealth we have close to 190. Yeah.
that's the biggest group, right? Of
Yes.
APNs
I would say
across Singapore,
across
right?
Singapore.
Okay.
Yeah. Because nationally we have about 400 odd.
Wow. Okay.
Yeah. So we have almost half
Of
the
like the population. Nice. Okay.
Okay,
Yeah.
quite popular, right?
Of course.
Time to join!
Yes, I'm coming.
Again, we will have this conversation after the tapes are cut. So I think we are kind of trying to wrap up at this point. So there's one sort of word of advice or for our viewers, what should they
Younger nurses.
out there, if let's say they're considering the APN route, so what can they do to prepare themselves from your point of view? What do you think they should
Need
be
to
doing?
study. Yeah.
Of course. 5 years, right? 5 years is the
Okay,
course?
so
How long is the course?
No, the course is 18 months plus
18
1 year
months.
internship.
Okay.
But SingHealth, we do have a
Own-
pre-preparation program
Right.
so that you don't struggle so
Yeah.
much when you go to the master
Yeah.
program, because it's a mindset change in terms of the training.
Yeah.
Nursing, traditionally, we are very skill-based, right? But I think with the Master of Nursing training is training you to be more, in a way, critical thinking, rationalizing a lot of science behind disease specifics and assessment of the patients holistically.
Yeah.
So need to beef up a lot of the cognitive knowledge
Yes.
that we need to build. That will then tie into the credibility that we were talking about,
Yeah.
right? Credibility in terms of your competence,
Yeah.
your performance, and then influence, how you actually want to influence in terms of patient care, evidence-based practice. So that also require quite a bit of readings in terms of what is the evidence out there. May not be medical related, but more of a nursing practice related kind of evidence. Influence, maybe a bit about humility, because then that is how you then collaborate and work as a team, because none of us is really independent, right? Although we practice quite independently, but as a whole, managing the patients really require a team to be able to provide the best care. Because we do have our area of expertise, and if somebody else is able to give that in-depth care for the patient in that area of expert, then of course then we work collaboratively with those. So those are the collaborations that we need to be able to build. Communication skills is very important, because we communicate to so many people.
Yeah.
We are like choreographing a lot of connections.
Yes. Yeah.
Joining the dots. Yeah.
Do I need to be a SSN to sign up for APN? Or SN also can.
SN you can. It's just that as a SN you probably are quite junior, right?
Yeah, a lot of things.
So the school criteria or SMB criteria is you need at least 5 years of clinical experience.
Okay.
But if you start thinking that you want to go down this track of the APNs, then the clinical track, we should start early, as early as like year 2, year 3, and then by the time we kind of like put you into the program and beef up some of your knowledge, right? By the time you are ready, it's just nice about 5 years or 6 years. Then you can go and do the formal program in school.
Right.
Yeah.
Okay.
So that will be. So it's a journey of preparation. Yeah.
Sounds long and daunting, but I think it's worth it. It's worth it, right? I mean, that's
It's
the whole.
a lot of the job satisfactions.
Yeah.
To me, I think it's a lot of job satisfaction because I get to see patients in the clinical area. Patients trust me. Of course, last time in the ward, right, is more. I must say it's more satisfying and challenging because then patients are sicker.
Yeah.
And I do get to review my patients a little bit more often now compared to like now I see them once a week. Yeah, in my clinical area.
Honestly, I
Nice,
thought
yeah.
APN is when I first heard of APN, I think I was still in school, and then I found out a little bit more about what APN is doing, and I thought, wow, so cool. I tell my friends, nurses can be APN too, can see patients. Yeah, then
So is that something that you're thinking now?
As we said earlier, this is a conversation we have after we cut the.
Not very young already lah, can get ready.
you need to prepare early.
Prepare early. That's the thing, right? Okay, we start early.
Yeah.
Okay, I think with that said, we kind of well covered like the scope of work, how APNs make a difference in the patients' lives. So with that said, I think we are kind of ending on a very warm and heartening note. So with that, thank you very much, Ms Julia, for joining today's podcast episode. So I'm sure our viewers got to kind of learn a thing or two from you with regard to what an APN does and how it makes a difference and how it's very fulfilling at the end of the day.
Even for, I think for ourselves, we also learn a lot more about APNs.
Yeah.
That's good.
Yeah. So
Okay, maybe
I hope you all can.
no, we are gonna have that conversation after the tapes go. Okay. So we come to the end of today's nursing podcast episode. We'll see you in the next episode. Take care. Bye.
Bye bye.